to the cloud. Awesome. Okay, so now we're on track. So good stuff. Good evening again. We're just going to invite everybody to keep your mics muted while our speakers are presenting, and then put your questions in the chat. We want to make sure to get to them, and then we're off. We'd like for you also to write in the chat your location or where you're joining us from so that we can recognize you. We like to celebrate where all of our participants are coming from. So just write that in the chat. Remember, we have a YouTube channel called Feet4Life. That's F-E-E-T, the number 4, Life 242, where you can watch all of our previous videos. And I guess by tomorrow, this video will be up there as well. So we invite you to go there, subscribe, and hit the notification button so that you know when we upload all of our videos. We also want to say that our YouTube channel is really growing. We want to say thank you to all of you who have been participating and been visiting them. Before we begin our program tonight, we have a short devotion like we usually do. We're going to invite Pastor Jan Dorset, who's from the Exuma district, to give us a short devotion, and then we'll be on to our first speaker. So let us welcome Pastor Dorset as he comes.
Thank you so much, Dr. Mitchell. I trust that everyone can see me and hear me clearly. Okay, so I think 1 second. Okay. Yes, good evening, everyone.
Good evening.
It's a pleasure to be here with you. And I'm just going to say a brief prayer, and then we'll take a look at this devotional thought for this evening. Father, we thank you so much for Dr. Mitchell and her team who put on this very informative meeting every month so that the community can be made aware of how to have proper foot health. We know that you are concerned about our physical health and also our spiritual health. And I pray that this devotional will be beneficial to all of us. In Jesus' name, amen. I want to share with you today about the fact that God is so concerned about our health. Not only does he desire for us to have good spiritual health, but he desires for us to be in the best physical health as possible. And I know that we are all desiring for that, which is why we are here this evening. We want to know, how can we take the best care of the feet that God has given us? Allow me to share with you what Christ said in John 10, verse 10. He said, "The thief cometh not, but for to steal and to kill and to destroy. I am come that they might have life, and that they might have it more abundantly." Now, what is so interesting is when we consider what Christ said, that he has come that you and I might have life and have it more abundantly, the definition of that Greek word there that was used when Christ said more abundantly, it is defined as superabundant in quantity or superior in quality. Christ desires for you and me to have exceedingly abundant life, beyond measure, more superfluous. And it is so interesting to consider this, that he did not just come to deal with one aspect of our lives, but it is his desire for us to superabound in every area of life. Allow me to share with you another passage. In Matthew 9:35, it says, "And Jesus went about all the cities and villages, teaching in their synagogues and preaching the gospel of the kingdom and healing every sickness and every disease among the people." There were three major things that Christ did in his ministry. Did you catch them? Number one, it says that he went about teaching. Number two, he went about preaching. And number three, he went about healing. And here we can see his desire for mankind to have this more abundant life. He taught how we could have good relationships with our fellow man, with God. He preached. He spoke about having a wonderful life, not just now, but in eternity. And of course, he did not neglect our physical needs because he could not go anywhere without healing someone. And as long as persons had faith, he was able to heal them. 3 John 1 verse 2 says, "Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth." So I just want to remind us today that Christ wants you and me not just to have life, but to have a more abundant life. In closing, did you know that scientific studies have been done with cancer patients? Some were experiencing serious diagnosis, and some of the doctors told them that they only had such a short amount of time left to live. Do you know that they studied two groups of patients? One group who had an optimistic outlook on life, one group who was willing to forgive persons who had wronged them, and also who made peace with God. And then they looked at the second group of persons who had the same diagnosis, but they were always negative. They held on to grudges, and they did not seek to have that relationship with God. Can I tell you that even though both groups were given the exact same amount of time to live, the one with the positive outlook, the one who was willing to forgive their fellow man and seek the forgiveness that Christ can offer, they outlived the other group who held a negative outlook, who were unforgiving, and who did not have peace with God. And so Christ desires for you and me not just to be spiritually healthy, but physically healthy. And I want to challenge all of us to seek the health and the abundant life that he offers. Allow me to say a prayer. Father, we thank you once again for the abundant life that Jesus came to offer us. I pray that every one of us will experience this abundant life. Please be with the moderators, be with the presenters today, and may we have a wonderful sitting this evening. In Jesus' name, amen.
Say it again. Thank you, Pastor Dorset. We hope you stick around to hear the rest of the presentations because that was a really encouraging devotional. Thank you so much. Now we're going to move right in. We know we talk about diabetes and the importance among diabetics. Foot complications are the most feared, the most costly, and often the most common, especially in our region. We see that very, very much. But we know that every second counts when it comes to diabetes. In 12 seconds, someone develops a foot ulcer. Every 7 seconds, someone dies from diabetes. Every 20 seconds, someone gets an amputation because of diabetes. So we can see that even the seconds are important when it comes to the diabetic and the diabetic foot. So here on Feet4Life, we're very, very concerned about that. And that's why we put this whole program together to be able to give you, your family members, caregivers, persons with diabetes, the skills and the knowledge to be able to improve their health and take care of their Feet4Life. So this evening, we have a power pack program for you. And as I mentioned earlier, October 8th is celebrated as International Podiatry Day every year. And it's important because that is when we celebrate foot health. And then it also is a time when we look at the contribution that podiatrists make around the world to be able to protect limb and lives of persons, not only with diabetes, but everyone. We've seen that seeing a podiatrist is actually better for your health, saves money, time, and lives. And persons who do not see them, especially diabetics, actually have poorer outcomes. So we're going to talk tonight a little bit about that. And we're gonna also talk about the shortage of podiatrists. I'll skip some of the introduction so we can get on to our speaker, and then we can talk a little bit about that afterwards. So this evening, we're gonna talk about the impact that podiatry has on healthcare and health outcomes. Our speaker, we actually have two speakers, as you can see from our video. Our first speaker is Mrs. I wanted to say that both of our speakers are veteran podiatrists, and I'm very pleased to be in their company. I'm actually the younger one now. I feel like I'm becoming the older one. I'm becoming the senior podiatrist too quickly. But anyway, they're veteran podiatrists. And so I'll introduce both of them, and then our first speaker will go, and then we'll have our second speaker. So both of them are actually very passionate about saving limbs and saving lives, and especially persons with diabetes. So our first speaker is Mrs. Simone McConnie, who joins us from Barbados, but she's actually in New York right now because she's on her way to Barbados. So, but she's committed, and I mean, I just love her spirit because, you know, she could have very well say, no, I can't do it. But she's on her way. So she's actually at the airport. So if you hear any flights being announced, that's okay. Okay. So she's a podiatrist. She completed her podiatry training in London, in the UK, at the Diabetic Foot Clinic at King's College Hospital in London, UK in 1993. She returned home and opened her practice in 1994. She also earned an MBA from Durham University in 2011. She's the regional co-chair for DFOOT International for the North American and Caribbean division. She is a strong advocate for diabetic foot and limb salvage for all persons with diabetes. She's the founder of the Saved Our Souls Charitable Trust, and she also served as the Chief Operating Officer for the Barbados Diabetes Federation. She has a motto, and I just love it. Every limb saved is a life cherished, because that is so important. When we look at saving the diabetic foot, it's not just about saving the foot, it's about saving a life. And that is what that motto says to me. Our second speaker is no stranger to us, and he's gonna come on after Simone goes, because he's a regular person on our program. He's also a veteran podiatrist from Detroit, but around here, we like to call him an honorary Bahamian. He has lived and worked here for several years and made a significant impact with all that he came in contact with, not only with his outstanding clinical and surgical skills, but with his compassion and drive to help prevent lower extremity amputations in the region. He is the co-author of the book. I'm sure you will hear about it if you haven't already. My Toe Can't Go. It's a children's book that promotes foot care and prevention of amputations. Help me welcome our first speaker, Mrs. Simone McConnie, who is currently at the airport, like I said, and she will go first, and then we will hear from Dr. Horsley. Welcome, Simone. Unmute.
Thank you so much for even inviting me. I'm sorry that when I accepted this, I was not supposed to be in a hotel in our airport, but I figured I can just about make it before I board my flight. So without further ado, I am going to share my screen.
You're a little low. Your volume is a little bit low.
All right, can you hear me now? Is that any better?
Yes, that's better. Go ahead.
Okay, so I'm going to go back to sharing my screen.
For typical customer traveling on flight 1701 with
Okay,
support locked,
everyone
Florida
can see
boarding
that?
is in about 5 minutes. So in the meantime, We are still seeking volunteers to check in the carry-on bags free
Can
of
everyone
charge.
see the
Yes, we can hear you, but get a little closer to your mic.
Volunteers to check in their carry-on bags free of
I'm not
charge.
sure
That
that
do
can
not
get
be my
much
goal.
closer.
We
I
can
can
hear you
try.
now.
I'll have to
All
I
right.
can try.
as soon as
So
better.
without
we reach
Okay.
once again,
So
we're
without
seeking
further
11
ado,
volunteers to check in the carry-on bags free of charge at gate number.
let me. Sorry about this. That may help. Let's try that again. Is that good now?
Yes, we can see it.
Perfect. Okay. So, in celebration of International Podiatry Day, obviously, I'm going to take this opportunity to promote podiatry and for people here on the call to recognize what we do as podiatrists. I'm not saying this because I'm a podiatrist, but it's an amazing profession. It's probably one of the most gratifying professions because it's very diverse. We're definitely not bored each day because we never know what's coming through our door because our span is so great. When we look at the Caribbean, it's quite a span. And unfortunately, I'm 30 years into practicing in this region. And unfortunately, a lot of medical practitioners and a lot of people still don't understand what we do. So, in a nutshell, podiatry, I think we should be thinking of it really as podiatric surgeons, which is like Dr. Horsley, podiatrists like myself, who do minor surgeries, but we don't do major surgeries. And then
Hi,
we have
Simone. You want to start the slideshow?
oh, sorry, yeah,
That's okay.
got it? Right.
Yes, awesome.
So, um, we are a healthcare provider, and we specialize in the treatment, diagnosis, and surgical interventions of foot and ankle disease. And I'm going to say this as a caveat here about ingrown toenails because the amount of people who come to me who's been on like a month of ingrown toenails off and on because of seeing their doctor who's put them on antibiotics for an ingrown toenail and then it doesn't resolve. It cannot resolve because it's not infected initially. It's inflamed because of that splinter or foreign body that the body is seen as a foreign body, the nail that's embedded in the side of the toe. Until that's removed, you can go on antibiotics for 6 months or
If you're
more,
traveling on
and it's
Jeff
never
Flight
going to
1701
resolve
with
without that
service to Fort
splinter
Lauderdale,
moving.
Florida.
The
At gate
best
number
person to
16, we
deal with
thank you for
that
choosing
is
us.
a
At this time, we are
podiatrist.
offering
I've
free
never
boarding to
seen
customers
it
with
managed
disabilities
well
to board at the
otherwise.
carriage lane.
And it's one of those things that's a small pet peeve for me
And we ask that
because
all others
when
to
you're
remain clear of the
diabetic,
boarding lanes
it
to allow
can
easy
mean
access
far-reaching
to each of the
circumstances
other boarding lanes.
because you can have infection
Customers
in
with
that bone
disabilities are welcome
eventually
forward.
if that goes on for so long. But stepping off of my caveat, we do all sorts of foot pain, all things related
Customers
to
traveling on
the,
flight
to the
1701 with
feet.
service to Fort
And
Lauderdale
today
will
I'm
now
going to be
welcome our
focusing
Mint of Mosaic
mainly on the
customers aboard at the
diabetic feet,
Leisure.
but we do sports and we have all other challenges as it relates. I think
Mosaic
the only other
customers,
thing
once
that
again, for
only other
traveling on flight
profession that comes
1701 with service to
close
Fort
would
Lauderdale,
be an
Florida. Mosaic
orthopedic
customers, you're
surgeon
now
who
welcome
has
aboard at your leisure moving
specialized
priority lane.
in foot and
Thank you
ankle.
for choosing us.
But other than that, we are feet people. And we deal with all sorts of foot issues from, you know, myxoid cysts to hyperpigmentation of nails to diabetic foot ulcers. We're one of the only professions that we actually train in the UK. We train and we do wound care as a huge part of our training. We're looking at the mechanics of the foot. We're looking at the foot function. We are here to keep people moving. One of the challenges we see in the region is the mixed, because we are a potpourri of different races. So we have all these mixed colored skin, and as a result, we have some circumstances that appear and are misdiagnosed. So you'll look at the top right and you'll see the foot looking really dark. This patient was misdiagnosed. He was diagnosed of having an ischemic foot, and he went on to lose his foot. So, some of these things are where podiatrists play a huge role, because think of it, the only thing we see is feet. But when we look across the Caribbean, we have a shortage. When we think about the fact that we are looking at approximately 44 million people across the Caribbean, we only have about 31 podiatrists in this region. The ones that I'm speaking of here now are the ones that are registered and are started our network. So in Barbados, we have 9. Trinidad, we have about 2. St. Lucia, 2. Bermuda, 12. Jamaica, 2. And the Bahamas has 4 podiatric surgeons. And I'm jealous of that because we don't have any podiatric surgeons in our part. But we do have some podiatric surgeons from outside the nation who pledged their help with us in the region. Now, I'm going to quickly say here, if you want to do feet like a podiatrist does, you got to go and train to be a podiatrist. There's no short changes. You know, there are lots and lots of courses out there for health practitioners and for assistants and, you know, all these various things. If that's what you're going to be doing, you need to work underneath a podiatrist or podiatric surgeon. There's no fast tracking being a podiatrist. It's not a pedicurist. It's a very, very intense program. And what we can do at the end of our training isn't something you can learn in a 6-week program. So what we're seeing now is, because there is a dearth, we're seeing a lot of people emerging as wanting to become foot specialists. We see a lot of nurses and a lot of people saying that they're foot specialists. And this is causing an issue because, you know, you would run into challenges where you're not managing those feet properly and causing more harm. And we think we have to be ethical and think about the harm that we're causing, not just the fact that you are trying to make money and fill a void. If you're going to fill a void, let's get our health ministries on board. Let's get our universities on board. Let's train feet podiatrists in the Caribbean. When we look comparatively at the USA, they have approximately 2 podiatrists per 100,000. They have 18,000 registered podiatrists. In the UK, they have 14.2 thousand registered podiatrists. This does not include foot care assistants. And in Canada, they have 1,244, and this is only based off of 7 of their 12 provinces. So yeah, there's a shortage not only in the Caribbean, but worldwide. And this is one of the reasons why when I was asked to do this talk today, I jumped on it because I'm on that podiatry bandwagon for advocacy right now. We need to advocate for more podiatrists, because if we keep doing the same thing the same way and expect different results, we're pretty stupid, aren't we? And I feel that the one thing that's missing in our diabetic foot world is there are not enough podiatrists. And, you know, if you look at this image on your right, this is how you can see diabetic feet. It's a lot deeper than just what you think, oh, this is a diabetic foot. Did y'all see that image? Did you see that there's someone holding a camera there? That's how the diabetic foot is. It's not that straightforward. It's not that simple. So, you know, podiatrists looking after diabetic feet, really and truly, there's a lot more than just face value. There's a dearth of data across the region, resources to support podiatrists. With the increase of diabetes, we know that based on international standards, we would need an increase of diabetic foot carers. And we cannot afford all these amputations. When you think of the limbs lost, the cost to our health ministries, you know, because patients don't just lose their limb and die. They live about 5 years, and sometimes those 5 or 6 years is 5 or 6 years of suffering. You know, they're in bed, they need help, they need to go. Think about it. You go to the doctor today, the doctor says you can lose your limb, and tomorrow, how quickly are you going to go to the bathroom? How quickly are you going to shower for yourself? You know, these are all added costs that when people are having amputations, these are not taken into consideration. We're cutting people's livelihood.
Group B is in blue. You
So,
welcome to board.
you know, I urge
Self-boarding
podiatrists
lane.
not to be deflated. I know it's very difficult working in an environment such as ours where the support systems seem poor. But in a region like this, we need to stand together and we need to educate each other and just educate everyone around us. I urge all the medical teams, or any medical doctors that are on this program tonight, to take a chance on podiatrists. You've been doing it the same way all the time. Why not try to bring a podiatrist on your team? See how much different that would make, especially if you're dealing with a lot of diabetic feet. Because with the increase of diabetes in our region, we will have more diabetic feet and more diabetic foot challenges. And I also will urge all health ministries and universities to start thinking about how can we facilitate podiatry training in the region? How can we facilitate podiatric surgeons? And it will start with proper legislation and regulations for this profession, which is still unfortunately a real challenge. But why do we need podiatrists? Yeah, we love feet, but what difference do we really make? Yes, we do. We save limbs, we save lives. Um, and one of the things I always say is, if you or anyone has been told that you need an amputation, well, then you should be able to go to 6 or 7 other healthcare practitioners or podiatrists or foot and ankle specialists, and they should be able to say, yeah, you need that amputation. If you go to the dentist and you have a rotten tooth, and you go to another dentist, more than likely they're going to say, yeah, you need to have that tooth out. So I think that amputations should not be seen in a callous way, because you're talking about people's livelihood, you're talking about people's lives, and you're changing their life forever. Feet don't grow back. So why do I say this? Right now, all the feet you're about to see have been feet that were offered either AKAs or BKAs. This is the difference that we've made. And these are just some of my patients. You know, we make a difference in people's lives, and it is one of the most rewarding things. You know, all of these people have been offered amputations, but in some way we've been able to circumvent it. Yes, it's much better to lose a toe and change that offloading, rebalance that foot, get them back loading, get them back to life, than to have that AKA or BKA.
Group C,
Healing
Group C is
chronic
in captain.
wounds,
Welcome to
you
board.
know,
Flight 1701 to a
each
search
of these were offered to
Group
have
A,
the
B,
toe
and C are
removed.
now all welcome to
You know,
board.
if we look to
Self-boarding
the
lanes.
if we look at this lady here, this is an ischemic ulcer. She was not viable for revascularization, but with good healing and treatments and offloading, she healed. This lady, the same thing. She was offered this toe to be removed, and the challenge is with an ischemic limb, when these toes are removed, the foot doesn't actually heal. So it actually opens another can of worms. So, you know, with good management and good teamwork, we were able to get them to heal. These people have gone back to life. These people have gone back to being able to afford living for themselves. This gentleman was offered, he had this um, non-healed ulcer for over 6 months in hospital, and it was just getting worse. And after a lot of frustrations, he came to our clinic and he ended up healing in 2 months. This is the changes that this is the impact podiatry has on our community. This is a tennis player who was told he needed an amputation. And he was like, I cannot have an amputation because I'm a tennis coach. And he was and it was still one of the most difficult patients I've ever had, because, you know, he was one of these guys that knew everything. And just because he knows everything doesn't mean he deserves to suffer an amputation. So we worked with him from a psychological perspective, from offloading. We built a team around him of surgical surgery, general surgery, and he went on to heal. But you know what? It doesn't stop here, because if you notice his foot, which is this last digit, um, just go back a second. This foot here, you can see he has prominences, and these prominences will go on to cause ulceration. So he was in offloading shoes, offloading orthotics, and guess what? In 2024, earlier this year, he presented on the other foot, of which he's already lost a toe, with a lesion, which turned out to be a lesion coming from a calcified area of his third metatarsal head. So he was able to have surgical offloading, and he's back to life. He did not lose his limb. an ischemic ulcer. 78-year-old lady who was told that she couldn't have any vascular intervention, and she's finally healed. We have the patience, we have the knowledge, we have the ability and the skill set to be able to be a valuable asset to our medical team. This lady was really interesting, very difficult with management, because we don't always have this perfect setting of a multidisciplinary team under one roof. But we were able to pull it together where she had vascular intervention, she had surgical intervention, she had proper wound care, she had offloading, and this is her today. And she was able to go back. She's someone who's used to do home help, and she was unable to go back to work. All she kept saying is, I can't afford to lose my foot, because then I can't work and I can't finish paying off for my house. So these people have dreams too. Why should we cut them off like that? Now, the difference is we don't have a podiatric surgeon. So she's still awaiting rebalancing of this foot. And if we look at the lateral side of the foot, there's a callus that comes here every now and then, which we're having a very tight monitoring on. But the thing is, her story does not stop here. So this is where podiatrists are becoming a dime a dozen, because we need to have podiatrists.
We now welcome
because,
the
it's not just about saving this limb, it's about helping her keep the
at gate
limb.
number 16,
This is a guy 10 years post
ADC
he had an nail
and E, you're
puncture,
welcome
he
to
was
board.
offered an amputation. And we calculated that it cost him about $50,000 to save his foot, but that was 10 years ago. So he went on to earn more than $50,000 because he was a guy that was in air conditioning. So think about if he had lost his limb. We need to think about the far-reaching circumstances of amputations. So podiatry is very diverse. It's very confusing for some because we have such a wide range of things that we cover when it relates to the feet. And everyone has feet. I have had over the years lots of mistrust from doctors, a lot of misunderstanding of the skill sets that we actually have. And a lot of it has to do with the fact that most of our doctors are trained in the Caribbean and they're not exposed to podiatrists. But a lot of the younger podiatrists are coming up now and they're open to change. And I feel that we just need to push the envelope on that because we need to encourage podiatrists. We cannot try to be more than we are.
For the time I gate number 16 flight
I don't know if anyone's seen Aurora Borealis, but it's an experience, and it's an experience of nature. And depending on where you go, when you go, everyone sees something different. And the diabetic foot could be just as diverse. Podiatrists are a dedicated team member solely focused on the feet. And if you have a diabetic foot specialist podiatrist on your team, you're in the right game. Podiatrists screen and are there for early detection so that we can do proper interventions early on to prevent amputations. I put this here. Would you go to a mechanic for a dental checkup? No. So focusing not on what podiatrists do and trying to do it, we need to train and invest in podiatry. As we approach November the 9th, celebrating Diabetic Foot Week and also World Diabetes Day, let's think feet. And if we're thinking feet, we're thinking about our podiatrist. We love happy endings, we love feet, and we love pretty things. And as a result, we like to keep feet. Here we have our current president of the Federation of International Podiatrists, where you can learn more about podiatry. And at this point, I'd like to say thank you very much for listening. Thanks for facilitating me in the airport, being able to still deliver this. And I hope you continue to have a good seminar this afternoon.
Number 16, Port Flight 1701 with service to Port Lauderdale.
All right. Thank you, Simone.
Welcome aboard.
You're welcome.
Okay, wow. I know we had some challenges there. I'm sorry. We could not be avoided. She was in the airport, so we did hear some flights being announced. But I'm sure I was able to capture the gist of her presentation. I'm sure that you were too. And if you want, you can come back and watch it again so you can hear it for the second time. But I heard her passion in her presentation about the role that podiatrists play and the difference that podiatrists make. You saw those pictures? They were awesome because those were legs and limbs that were saved. They were lives that were saved. And that is something that we do every single day. And I was very, very, very happy that she covered that. I'm sure we're going to have her back again because I know that she has more that she wants to share with us, especially I saw those pictures and I know she have more of those for us as well. So now we're going to move on to our next presenter. But before we do that, I just want to recognize some of the persons who are here or where they're coming from. And so, of course, we have New Providence. We have all the persons from New Providence here. We're up to 92 so far, so we're almost at capacity today as well. We also have persons from Trinidad and Tobago. We have, of course, Simone is from Barbados by way of New York. Dr. Horsley is with us from the Motor City in Detroit. We have Dominica. We have St. Lucia well represented in our chat today. So go St. Lucia. I was actually in St. Lucia earlier this year, so I'm very excited about that. We have Columbus, Ohio. We have Providence, Rhode Island. We have, of course, Freeport, Grand Bahama. We have Exuma in the house, and we have tons of persons from New Providence. So if you are from somewhere else that I did not recognize, then go ahead and jot your location down in the chat, and we will recognize you when we have our next, as we move on to our next speaker. So Simone had to board her flight, so we're gonna have to get her question. If you have any questions for her, we will have to get them to her, but we wanna say thank you very much, Simone. That was just in time so that you could catch your flight back home. So safe travels, and we will definitely be having you on the show again for us, because that was wonderful. Okay, we have Antigua on the chat as well tonight. So thank you so much. Great job, Simone. Thank you so much. So we're gonna move on to our next speaker. So before we do that, I wanna just, Simone mentioned already that we have a shortage. And so I wanted to mention that here in the Bahamas, we actually have 4 podiatrists. At one point we had, I guess we've always had 4, because we had 2 podiatrists that died, Dr. Rain and Dr. Dorset, which would have made us 6. But we currently have 4 podiatrists for the whole entire Bahamas. And we have, all of us are working in New Providence. So the Family Island has very little access to podiatry. So we definitely see that there's a shortage here in the Bahamas as well as the other countries in the region. So we're gonna invite Dr. Horsley now to give us our presentation on his presentation. And we also wanna welcome our guest from Michigan as well. Michigan is in the house. And so we wanna see that as well. Grenada as well is in the house. So we're gonna get Dr. Horsley to begin, and then we'll recognize anybody else who's on the line. If you have questions, please remember to put them in the chat and we will answer them at the end. Thank you so much. Let us welcome Dr. Horsley.
All right, I hear the round of applause. Thank you very much, everybody. And I'm going to applaud everyone back for making it here this evening. That's beautiful. Dr. Mitchell, you're able to see my screen?
Yes, I can see your toe, your big toe.
Yeah, my toe can't go. Simone was the perfect segue into my presentation for International Podiatry. My toe can't go is I've co-authored this book with a native of Nassau, Hillary Duncombe. And together we put this book together to save a toe and other limbs. And it's a book, it's a medical book for children and adults. So I was sending this flyer out, and I'd see some people, and I'm peeking through the chat room and who's in attendance here, and I'm glad people responded, and I got a few responses back like that. Most were like, hey, I'll be there. Can't wait to see what's going on with the feet, what's new. We know there's only 10 podiatry schools in the US. There were 5 when I attended about 40 years ago. And there's one in the UK that Simone went to. And for 11 podiatry schools and 7.8 billion people on this planet, there will never be enough podiatry. And because there aren't enough podiatry and for podiatrists, it's hard to recognize because of all the responses I got back when I sent out this flyer. Here's one response that I just had to show everyone this evening. It was this. And I'm like, what the heck is that? Is that an elbow where someone slipped and fell? And because the young lady who sent it to me is probably 42-ish, early 40s, a glamorous lady from Nassau. And I said, oh, we were discussing what the heck is that? And then it turned out, I said, it's not the elbow. She didn't slip and fall and scrape her knee and just showing me. And then it dawned on me when she sent the other 2 pictures, which I am not going to show. She had had 2 previous, I'll say, debridements. And the third debridement was that of her lower leg. And the third debridement was a BKA. So she went from the first debridement, which was similar to Simone's presentation, where a couple toes were missing or half a foot. Then I took a little bit more up to the ankle, and then the third procedure was a removal of the leg below the knee, very common, called a BKA below the knee, and then of course there's an AKA. So knowing that there are not enough podiatrists, enough podiatry schools, not enough vascular surgeons, first responders for this problem would be the medical doctors, diabetic educators, nurse practitioners, etc. And they have to recognize the early signs of amputation. And the earliest sign of amputation you can recognize will be revealed during my brief talk tonight. Type 2 diabetes and concurrent amputations are off the chain. Top scholars totally agree that is ridiculous. It's just extra, like some of the youth say, and it's getting worse. The pandemic status of type 2 diabetes began in 1995, around the time Simone was saying she got into podiatry. This current pandemic that we're in is devastating to our community, and it appears that type 2 diabetes, T2D, and T2D amputations are at the Rubicon, or the point of no return. So it won't be getting any better anytime soon. Finally, a solution for the pandemic is now available. A children's family medical book for grades K through 12 and beyond. It's STEM compliant and can improve reading and math skills. It enhances critical thinking skills as well, not to mention CRRP for those who are teachers, the cultural responsiveness and pedagogy, and responsive pedagogy. And it addresses the lifestyle and nutritional improvement awareness. Hey, which way we going? Let's go this way. Okay, so My Toe Can't Go, written, co-authored by myself and Hillary Duncombe, deals with a little girl coming home from school so excited. Her name is Pineapple Ariel. And she comes home to tell her Grammy, guess what? She's just so excited. And she says, the response, what's all the excitement? And from Grammy Burger. And we can start our recipe ideas in this book. And we talk about portobello mushroom burger, which are absolutely delicious. Let me see, your screen sharing, I got to move this over so I can see. There. Okay. So Grammy's burger response is, "Oh, thank you, baby. I would love to be there," because the little girl was telling Grammy, "I've invited you to my favorite person day," and that was at school. And everyone gets to bring your favorite person day to school. And she's telling her grandma, she's you're my most favorite person in the whole wide world. And we have activities in the book as well. Ask the kids to think of their favorite person in the whole world. And obviously, Pineapple Ariel's favorite person is her grandma, Grammy Burger. And she said, "But I don't think I can go," Grammy Burger says. And Pineapple Ariel is saying, "Grammy Burger, what do you mean you can't go?" "Oh, child, please look at my toe and tell me what you see. Grammy's eyes are bad and my vision is blurry. I just don't see things the way I used to anymore." Pineapple Ariel takes a look at this toe as she pulls the sock off, and you can see the beautiful ocean in the background. And she's taking the sock off. Grammy Burger's looking down, and sure enough, "Oh no, Grammy Burger, your big toe has a weird color. It's kind of shiny, and it looks like it hurts. Probably a little stinky too." I added that. Grammy Burger replied, "I'm feeling no pain." And that's the problem, is that all of these amputations have one thing in common: no pain. And why no pain? Well, let's find out. But before we do, there are activities. For example, the hibiscus in this book, the hibiscus flowers can be used for tea. Hibiscus tea is excellent. And here's a recipe for hibiscus tacos, hibiscus salad. Also, talks about an idea recipe, pumpkin Androsian coconut pumpkin soup. And that is one of my favorites from living in Nassau for several years. So Pineapple Ariel takes a look at this toe and says, "Oh my goodness." She says, how can this be? How can that be? It really looks like it hurts a lot. I think you need to see a doctor right away and find out what's going on with that painful looking toe." She goes running in the house. "Mommy, come quick, quick, quick. Grammy Burger has to go to the doctor right now. Her toe can't go." And Mommy Broccoli responds, "What are you talking about, little baby girl? Grammy's toe can't go. Show me." And sure enough, she pulls her out to the front porch, takes a look at that toe. "Oh my goodness, we need to get to a foot doctor right away." Grammy Burger is asked by Mommy Broccoli, "Does it hurt?" Grammy Burger, "No, it does. I don't feel no pain at all." So here they are in the hospital, and little Pineapple Ariel is all worried and upset. Later that day, they're there. And it's a good thing the podiatrist is able to see Grammy right away, says Mommy Broccoli. Pineapple Ariel replies, "Podiatrist? I thought you said Grammy was going to a foot doctor." And we go on with the vocabulary word, what a podiatrist is, which is a foot doctor. And there's the foot doctor. Dr. Sugar Apple introduces himself. "I'm your podiatrist. Now let's take a look at that left foot and see what the problem is." "Oh, a podiatrist is a foot doctor," Pineapple Ariel says. Mommy Broccoli replies, "Yes, baby girl, you're right. Let's see what the doctor has to say about your Grammy's toe." So Dr. Sugar Apple goes inspecting the toe, taking a close look, and he starts off with the number one disorder that Grammy has. It's called polyneuropathy. And little Pineapple Ariel replies, what?" Dr. Sugar Apple says, "Hey, say it like this, polyneuropathy." And she replies, "Oh, now I get it, polyneuropathy." And that is the leading common factor of all type 2 diabetic amputations is polyneuropathy. And then there's a vocabulary page shortly thereafter that tells it, I'm not going to read, but it kind of tells you that polyneuropathy, I'll read the first one, means that some of the nerves go bad and you can no longer feel pain. This can happen to the feet and sometimes happens in the hands also. So while Dr. Sugar Apple is expounding on his theory and Pineapple Ariel, she's over there having a fit. She's like, oh, this don't look good. Look at the face on that little girl. And Mommy Broccoli too. So Pineapple Ariel runs over as she's listening to the conversation. She interrupts and she says, no, doctor, please don't cut off my Grammy's burger's toe. And as you can see, the thoughts in her mind of Dr. Sugar Apple and his assistant ready to remove that toe in her mind. She's having a fit. What will happen to Grammy Burger's toe? Will Pineapple Ariel be without Grammy Burger on Bring Your Favorite Person to School Day? Or will polyneuropathy awareness end this type 2 diabetic amputation pandemic? Are you ready for a lifestyle change for better health to everyone is my question. Because like Dr. Mitchell said, every 20 seconds is an amputation globally, every 3.5 minutes in the US. They're spending in national health care, NIH, it spends about $100,000 per amputation. In the US, it's $150,000. For the person that had 3 amputations, that's $300,000. In the US, that's almost $450,000 spent. And it is just getting off the chain. Type 3 diabetes is now emerging, and it leads to dementia and Alzheimer's. For your information, 80% of diabetics die from heart disease and type 2 diabetes, plus my main thing, polyneuropathy, equals foot ulcer or wound, which lead up to an amputation. So in the book, as we plan to stop this pandemic, and I invite everyone on the Zoom to have thoughts on how we're going to stop, how we're going to approach our neighbors, families, and friends and stop these amputations, and they're occurring at younger ages. So there's activities about vital signs and blood pressure. There's fill in the blanks. It tells you what some of the normals are and some of the abnormals. And then the activity asks Pineapple Ariel to actually record Grammy Burger's numbers and put them on this chart. And you do that daily. And I know they have fancy, sophisticated apps on your watch and on your phone, but I find that most people in the Caribbean don't have the data they need to be able to use the apps that are taking up just too much energy, too much money, so they have the basic phone service. So we invented this book with this chart, and if you fill it in every day and take it to your doctor will know daily that when you come in and say it was something I ate last night that makes my foot black and looks like it needs to be amputated, it's not something you ate last night. You look at the doctor will look at the chart and be able to tell exactly the pattern and the eating pattern as well. So in conclusion, diabetes and polyneuropathy awareness is what leads to amputation prevention. Training us doctors and nurse assistants, physician's assistants, nurse assistants, training diabetic educators, training is just not enough. We all have to stop polyneuropathy, and on the way to do that, stopping polyneuropathy is My Toe Can't Go, and you can either order one for yourself today or order for a loved one. And by reading this book, what this will do is stop the next generation, because the United States is spending about $20 billion annually, and it's projected in 5 to 10 years, 5 to 7 years, that number will double or triple spending for amputations. So I want to thank you very much for allowing me to stop in today and be a guest speaker and talk to everyone. And I just wanted to let everybody know My Toe Can't Go is the book that will reverse this current pandemic. And it's not an epidemic, because epidemics are controlled. Pandemics are out of control. This pandemic started, as I said, in 1995, as you know. And what year did you get out of podiatry school, Dr. Mitchell?
2006.
Right. So you'll find a lot of your training, and I've worked at the Dr. Scholl College of Podiatric Medicine. A lot of your training is wound care, just like Simone's. I noticed they're really big on that in school, as well as bunions and what have you. But it's the main thing is wound care. But what we need to do is get a copy of My Toe Can't Go into the hands of every child in the world. And when they get this workbook and when they read it and they apply it, we will see the numbers dropping drastically. And once you save a toe, you save a life. All right. Well, thank you.
Excellent.
Thank you.
Thank you, Dr. Horsley. Excellent job. Excellent job. So I am so excited. I mean, I was mesmerized just as you were going through the book. So in the chat already, we already have here, this book needs to be in every family's library. And that is definitely what Dr. Horsley is advocating. And we need to support it because I love the story, because at the end of the day, that is, as Bahamians and a lot of us from the region, storytelling is such a big part of our history and our culture that it's a wonderful thing. And somebody also mentioned about Mr. Dr. Sugar Apple. The characters are beautiful, you know, so it's very, very engaging. And for even us as adults, so definitely for our children, we will definitely do that. So one of the things that we had discussed with Dr. Horsley as well is looking at the fact that, okay, we can engage children and young people as part of our army to be able to identify these problems. So once we use this book as a tool, and it comes with a teaching aid as well, a lesson plan, so that these young persons and teenagers would learn to identify challenges with their parents and grandparents, you know, even their own feet, because we have a lot of young people who are diabetic as well. And then they can be a part of the solution in helping their family members or friends or whoever it is to get into care early. That's what International Podiatrist Day is all about, looking at access to care. We know that there's a shortage of podiatrists, there's a shortage in schooling and all of this. So we need to definitely promote the training, but we need to give persons the skills to be able to identify when there's a problem so that they can go to the access points to get care. That can be at, for example, South Beach Clinic, where we have a podiatrist. That could be at one of the private offices here about in New Providence, or on several of the family islands now. We have visiting podiatrists. And then also going even to the government clinics or to the nurse or wherever it is, because you just need some help. It's better than staying home and doing nothing and then losing your feet. So we want to get persons to get all riled up and excited. World Diabetes Day is November 14th, next month. And we definitely want to be promoting this book. We want to get you, we're going to ask Dr. Horsley to put that, the website or where to buy the book from. We want to, tomorrow, we want to see a whole bunch of persons going there and purchasing that book, because we want to get that in the hands of everybody so that persons can know what it means when we say, no, that toe can't go. And why is that so important? Because that is a common experience for a lot of our Bahamians, and they're getting younger and younger. I think the youngest Bahamian so far that I know about that had an amputation because of diabetes was 23 years old. Right. So that is a tragedy. Right. So we have to do something about it.
Right. You're so right about it's affecting our youth, and there's no end in sight for this current pandemic. Of course, we all remember this. walking around for 17 months with this on. I never could figure out how these would stop the pandemic. And we were still passing money around. They would tell the school children, no sharing, don't touch each other. But yet, try to hand somebody $100. COVID, you can cough on $100 and hand it to somebody during the pandemic, and they'll take it. And so the new pandemic, type 2 diabetic amputations, that's the new pandemic. And it's going to take more than a mask. It's going to take more than an ocean. This book is available on Amazon. I prefer that you register, put in your email with store.bookbaby.com. Dr. Mitchell has put it in the chat room, and I put it in behind her, store.bookbaby.com. And then we can all stay in touch through BookBaby. Leave your email. I can keep my statistics, who's buying the book, where it's going, all the demographics. So I really appreciate the opportunity to come on for International Podiatry today. I feel as the senior member, and I'm going to try to stay that way too for another 20, 30 years, if all possible. And then one of the most heartwarming messages I saw with the thumbs up when I was sending out that flyer or the invitation, and someone said to me from Nassau, welcome home. That's all, isn't that nice? Because I felt like that is still my home. A lot of people in Nassau adopted me. Only 1 or 2 people kicked me out, which is, I'm just playing. No one kicked me out because everyone is so beautifully warm and welcoming, and I learn and I work together with all 4 of the podiatrists in Nassau, including yourself. And I look forward to coming back and continuing that relationship and going into the other Caribbean islands and around the world with this book, to Africa, Malawi, Senegal, you name it, Ghana, Barbados. Get one to Miss Mia Motley, the PM in Barbados, and see if we can get everyone to read this book and understand what word? Polyneuropathy. It's a vitamin B deficiency, and without that vitamin B, then your cells don't act properly. And when they don't act properly, they don't produce energy, and it takes energy to not only run the nerves from your brain to your feet, it takes energy to keep the nerve alive. And if we're not eating the proper foods and taking the proper vitamin B, polyneuropathy will be a big problem in the future.
Awesome. So we have Charles Perry is saying he has one in his office already. So awesome, awesome, awesome.
Right,
good job. So the name of the book is My Toe Can't Go. So look for it. And then we're going to invite persons now. If you have any questions, we'll take a few minutes to answer your questions. Then we'll be able to, so Dr. Horsley is here, I'm here as well. So if you have any questions, especially about podiatry, about diabetes, about the shortage, about my toe can't go, or any questions at all, so you can put them in the chat and we'll be happy to answer them for you. So I'll just take a moment and scroll. But our first question, Dr. Horsley, is you had mentioned the need for additional training around the region, because Simone also mentioned it in her presentation about the shortage of training. And so I would just like for you to also mention that. We know that we have shortage of schools, but what are other opportunities for training? So how else can we harness technology like we are now, and other means of training that we can do so persons can actually be able to help in this area?
Well, one of the 4 podiatrists in Nassau who I work with, one of the great Dr. Danny Johnson, we were actually involved with a team approach, and we were teaching the 3rd year medical doctors, and they would do rotations every 4 weeks. And I met a bunch of wonderful people, Dr. Adderley and Dr. Dorset, and you just name it. They were just, and open their mind. They don't teach podiatry or any podiatric services or any knowledge in medical school. No save a limb in medical school. They're too busy saving your life, which is what they do. And then they get out. And so it was an extra course to medical doctors. So we're looking to train the medical doctors in the Caribbean, starting in Jamaica, starting in the Bahamas. I'd love to come to Barbados, Trinidad, Tobago, TNC, you name it, Turks and Caicos. I'd like to get around, and if I could help train continue to train these medical doctors on how to recognize and how to do simple procedures. If they're assigned to a family island in the Bahamas and they get an ingrown nail, if you just dispense antibiotics, it won't work. You have to physically oftentimes remove the nail. And so just training medical doctors on ingrown nail removal has been valuable, has started saving limbs in the Bahamas. And so that was an excellent idea that Dr. Johnson had to incorporate that.
Awesome. So we have two areas that we already thought of. One is the using the book or similar tools to be able to use it with lay persons and primary and secondary in school settings. Then we also talk about using medical linking up with the medical training so that we could train young doctors. Simone did mention that a lot of times there may be friction or mistrust because of the lack of exposure to podiatry during the medical training in the region. But because of the medical school being here in the Bahamas, and we do have access to podiatry here, those medical doctors are being exposed, and they are trained, they are making referrals and sending their patients. And I can agree with that as well here. I find that the doctors who are trained in the United States or Canada or somewhere tend to refer more because I guess of their exposure to podiatry in that setting, as opposed to the ones that maybe came from UWI or whatever. They tend not to refer as much. But I agree that with the younger doctors, that is changing as we move forward. And so I thank God for that. And we need to have more of such programs like that one so that we can see how we can improve that and it definitely move towards a team approach.
Right.
Yes. So it says, what is the strongest method or item you use to heal a stubborn wound on the toe? So I can answer that one. There are multiple modalities that we use to heal a wound on any part of the foot, but that is not the most important thing. With a diabetic ulcer, offloading is the most important thing on any diabetic ulcer, no matter where it is. But first, we need to identify what is the etiology or the cause of that ulcer, and then we can attack that, and then the ulcer will tend to heal. We need to make sure that there's no infection, there's no blood flow issues, and then we will be able to do that. So we really cannot answer. This is not a question that we can answer and say, use this or use that or use the next. That person would have to be seen and evaluated, and then we can better answer that question.
And I like your
Okay.
response, Dr. Mitchell, which is the strongest method. We both know that a good vascular evaluation, a good workup, period.
Comprehensive, yeah.
Right, comprehensive workup. There are 5 systems we're checking at the podiatrist. So we're checking your mental status, your nerve status, your vascular status, and you're looking at your skin. We're looking between your toes. We're looking for trouble, but we have to evaluate. So a good evaluation, I think, is the strongest method to heal it. And check the flow to the toe. You may have great flow to your ankle, but you may have to get an angiogram, arteriogram to check the flow. Is the blood getting past the ankle and to the toe? And it might be a blockage. So you need to have and like you do already with Dr. Farkinson, you work extensively with him, and together that team approach and other medical doctors is just a beautiful thing.
Awesome. So definitely we know from the research and everything that the team approach is the most effective way to treat any diabetic complication. And so we have another question here. Who is fighting for podiatry in the islands? I wish Simone was here because I would say definitely Simone has been fighting for many, many years. And there are a lot of advocates for podiatry. Currently in the Bahamas, we do not, other than our private individual podiatry clinics, we do not have foot clinics in the true sense of the word. In, I think, Grenada, no, not Grenada, Guyana. Guyana, they have a very, very strong foot program, diabetic foot program, where they have established foot clinics that are multidisciplinary, and it's in the public system where they see the bulk of the people. And so that is what the idea with I think it's Dr. Perry is talking about. Yes, Dr. Perry is asking about, but in our country, in the Bahamas, we do not have that currently. We're advocating for that. And also in the region, as far as I know, Guyana is the only country that has that in that format, where they have dedicated foot clinics. And it's a good model. I would love to go there and visit and see how we can incorporate that here as well. But it's an awesome model, and that would be really, really good for us to do. But I think there are advocates that have been working. I would say Dr. Johnson has been an advocate for podiatry for a long time here locally. I know Dr. Simone has definitely been not only in Barbados, but in the entire region, because she's really the glue that's pulling a lot of this together in terms of the other countries, the smaller island states and stuff. So I would say she's the biggest one that I know of. I actually met her in Den Haag. I think it was the International Diabetes meeting. It's every, I think, 2 years. So that's where I met her first. And even at that time, she was advocating and fighting for podiatry in the region. So yeah. So in the Bahamas, you mean, Dr. Perry?
Yeah, probably, yeah.
No, we take insurance as well here. Some of the other islands do not have, can't do insurance yet, but yes, we do take cash as well as insurance. Okay, so for the treatment for diabetic foot, we do. So any of them. The biggest challenge I feel here in the Bahamas is that a lot of persons may not have access, do not have access to podiatry care, because it is not readily available in our hospital. It is not readily available in our clinics. It is available privately. However, a lot of persons are either not working, the target population is not working, or they have very high deductibles for their insurances. So they may not have access to the care, even though it may be available. And then also NHI, which is the national health insurance we have here in the Bahamas, does not cover that, because it doesn't cover, it is not considered primary care. So a lot of persons like the elderly persons, or persons who may be unemployed, or persons who need that service may not have access to it. So it's definitely an area we need to advocate for, all of us, for our people and for our family members, so that they too can have access. Go ahead, Dr. Horsley.
That's so ironic, where governments, plural, will pay for the amputation, for the 3 amputations on my right leg, but they will not pay for me to have my ingrown nail done by Dr. Mitchell, Dr. Johnson, or anyone in the Bahamas. They won't pay for that.
Or in general foot surveillance, even before you need the ingrown toenail. You have your feet checked every 6 months, so once or twice a year.
It's called penny wise, pound foolish, or ounce of prevention, and so on. This is it, awareness. That's what's going to stop. Another wound care clinic, another 4,000 podiatrists. None of it will work, as well as awareness for our next generation. And we have to stop them from becoming obese, lazy, eating all this junk food, and living. You can't help that they're living in what they call food deserts, where when I was a little guy and I visited Nassau when I was 10, there were fruit trees everywhere. And when kids came home from school, they could grab an orange or a mango on the way home. Now you have orange candy, orange soda, orange, there's nothing real on the way home, and all the sugar on the brain. and translates into bad food, bad oils, and lack of awareness. So it's going to take a lifestyle change. It's going to take awareness. And you start using this book daily. It's a workbook for every child. And that's what, in my opinion, is the new approach to stopping the type 2 diabetic amputation pandemic crisis, because it's at a crisis level now. I think the Bahamas might be spending 300 million. Okay. Now, if they could take a small percentage of that 300 million spent on amputations and purchase these books for the school children, and they'll find that the annual 300 million, instead of going to 600 million in 5 years, it'll go down to maybe 100 million once you have awareness, and you'll stop it and nip it at the bud.
Excellent idea, Dr. Horsley. We have a comment in the chat that says, so we need to advocate for podiatry as part of primary care so that persons can get that primary, their surveillance and their monitoring of their feet before it gets bad, before they get to the point where they need to have that amputation. And yes, Dr. Perry, a lot of persons do come when it's late, when it's a little bit late for prevention. So they come when they really need to either have a massive debridement or amputation. And I know Dr. Simone had mentioned the BKA and the AKA, and I just wanted to clarify what they are. So the BKA is really a below knee amputation. That's when the leg is cut off under the knee or below the knee. And then the AKA is when the leg is cut off above the knee. And a lot of times persons are asking, why do they have to get an amputation? And the most important reasons are going to be either vascular, where they don't have enough blood flow to be able to heal that ulcer, or they have a bad infection that will cause them to die if they don't take that infected part off. And Dr. Horsley mentioned, most important, that neuropathy, because that's the beginning of the end. When persons don't have that sugar under control, and they end up getting that neuropathy, which is the loss of sensation, the polyneuropathy, both sides, both feet, coming from the toe, coming straight up the leg. And that's how you know it's polyneuropathy, and it's symmetrical, meaning both sides. So once that develops, a lot of persons will end up getting or begin that slippery slope towards amputation. And so we want, as podiatrists, and as health professionals, we want to prevent that from happening. Using the book to increase awareness and education. We want to definitely educate our patients every time we see them, have them take off. A simple thing I tell patients all the time: when you go to see your primary doctor as a diabetic, take off your shoes. Take off your shoes. That will force them to look at your foot. A lot of times persons don't want to do it because they don't want the doctor to see their foot. But all of us are part of this team.
Dead skin.
All of us are part of this team. And so if I'm, as the podiatrist, cannot see your foot, somebody has to see it. The nurse has to see it, or the primary doctor has to see it. Someone has to see it so they can raise the alarm if there is a problem. So take off your shoes. Take it off when you go to see your doctor, so they'll remember to take a look at your feet. Yes, sir.
Well, Dr. Felipe had said, well, yes, we need to advocate for podiatry as primary care. It's a very interesting statement. And yes, it's a great idea, but once you leave it in the hands of the politicians, it might take forever or never. So we need to advocate saving the next generation with My Toe Can't Go. And once you get that into the children's mind, to be more active, to eat more healthy, to change their lifestyle, then they can monitor family members. And there's a little guy, he's on the spectrum. Some things he can't remember. Little guy on the spectrum, he had a fit in school when they cut the gingerbread man up that they baked. He thought they were killing the gingerbread man. He just went off. He read the book with his grandmother, My Toe Can't Go, and he is our biggest advocate now. The little guy on the spectrum of autism. Grammy, how your feet today? How your toes doing? And so we need more of our youth. We need to just avoid trying to beg Congress to let podiatry get paid for, because then the bill goes from 20 billion to 40 billion. We need to reduce that by awareness.
Awesome. So Dr. Horsley, we have another question from Dr. Perry again. Are there any studies on how many amputations and death and blindness there are as opposed to the United States or the other islands? Yes, we do have, there is, like Dr. Simone said, we don't have as much research as we would like, but we do have some studies and some data. So we definitely do have some information that we can do. And I can definitely say that the BKA is the go-to procedure. We did a study, I think in 2010 or 2015, around there, and the BKA was the #1 procedure, the most common procedure performed in our hospital here at Princess Margaret. It was, I think, around 50-something% was actually the below knee amputation. So that is definitely the go-to procedure when it comes to the diabetic foot.
Because of time passed by, where if you don't feel that if you don't have a toothache, how do you know the tooth is infected? It's a toothache, but they can feel a toothache, but you can't feel a toe ache, and that's why they don't go to the doctor, because of polyneuropathy. And if we end polyneuropathy, we can end this, and we can really end this amputation crisis.
So yes, another comment in the chat is saying, very interesting discussion. Thank you for bringing this to the public and making us all aware of diabetes and its impact. Wonderful. Yes, Ms. Williams, we did answer your question already. Your question was, what is one of the strongest method or item to use to heal a stubborn wound on the toe? We answered that a while back. The #1 thing we said was to have a complete podiatric assessment so that we can actually know what's going on. There are so many products out there. We cannot really say use X or use Y or whatever. That type of answer we cannot give. But the patient and the toe need to have a complete or comprehensive assessment to make sure that there's no infection, there's no bony prominence, there's no pressure, there's good blood flow. There are many, many reasons why a wound may not be healing, and we have to identify all of those reasons and rule them out. And so we can't, the best what we came up with was the best would be a comprehensive assessment. And so you can give me your information, and then we can talk about where we can get that done. So we can see exactly where we can get that done.
He's talking to the right person, because hats off to you, Dr. Mitchell. You're a wound care expert. I think you've gone beyond, starting with your nursing degree and your background, and then going to podiatry school and becoming a physician and surgeon of the foot and ankle. And now your wound care skills are exemplary. It's just, you know, all the products, what category. So she needs to come right to see you. That's the first stop. And then work together with you and her medical doctor to keep her glycemic level down, or her blood sugar lower or proper. And you'll tell her where to go from there.
Okay, she said her mom has a podiatrist, so she was interested in knowing if there were natural options that laypersons could use on non-complicated cases. I would say probably ask your podiatrist, since they're looking at the foot. I think that will probably be your best bet, because I really cannot give an answer blanket like that. There are so many products out there. I think the best thing would be to ask your podiatrist. Will a Zoom meeting link be made available for those who turned in late? Yes, you can actually go and watch the whole entire video on our YouTube channel. It is Feet4Life 242. So give us a chance today to put it up. Probably by tomorrow or the next day, the video will be uploaded to that website. So you can go there and watch it. I'm sorry you missed the beginning, but you can go there and watch the whole video.
Feet4Life.
Yes,
242.
Feet4Life 242. I'll type it in the chat
I'm
so
typing
you
it
know
down.
exactly. Okay, go ahead.
On YouTube.
Yes,
All right.
on YouTube.
There we go. Feet4Life.
So,
because I needed to know for myself.
awesome. And so all of the videos that we have done for the entire year has been uploaded to that YouTube channel. So you can actually go there and watch them and at any time you want. So great presentation. Great presentation. Thank you for the work that you are doing to educate persons, to save limbs and save lives. God bless you.
All right. Thank you for the
Okay.
blessing. Always needed.
Yes, so we have more persons are just saying thank you. They appreciate you. Dr. Horsley, we just want to promote that book. Just listen up, persons. We are trying to get that book in the schools, in the Ministry of Education. So if you have any contacts, let me know. And then we are able to do that. If you have a private school or you know of a school that will be interested in partnering with us, we're going to be working on this for the entire year. We're actually going to promote this book as a book for when the Barry team comes in March, that we can use that as well. So just listen up. And if you don't see it in your neck of the woods, you can always reach out to me. My phone number is 605-3668. You can actually get me there, or you can any number. My website is familyfootcenter.com. You can always reach out to me, and then we can partner and be able to work together to get this book in the hands of persons who it can make a difference in their lives. We feel the increasing awareness and education is the way to go, because even if we got more podiatrists, we got more people, until we are able to change the mindset and the attitude and the behavior of our people, we're not going to see the results. So we need to work on that as well. Simultaneously, if you know of a young person who would like to do podiatry or interested in doing it, I do shadow visits. Persons can come and spend a day with me and see if they're really interested in getting there. And we're asking the government to be able to fund podiatry training for persons. So if you're interested in that, that's also a way to go. So definitely, we know that this is a challenge. That's why so many persons are getting amputations. So many persons are losing their legs. And the statistics that is most deadly is that persons who get an ulcer, a diabetic foot ulcer, or an amputation, about 70% of them, 68+% of them die within 5 years. That's more than persons who have breast cancer and prostate cancer. So we know that these persons, when they have an ulcer, an amputation, it is tantamount to death. So we cannot be fooling around with this. We need to do something and make a difference. We see here now we have 84 persons still on the chat at this hour, because this is something that is very serious, and we need to do what we can in our neck of the woods to be able to do that. November 14th is World Diabetes Day. Listen up and advocate. Talk about it. Talk about it. Wear your blue. Increase awareness. Talk about the book. Share about the book about diabetes. Definitely. If you need any help, you need someone to come and talk, I can talk. Just call me or text me, let me know, and we would be able to have a speaker there for you, as well as being able to present if you want us to.
And I'm also working with a couple of groups that are teaching reading here in Michigan out of Oakland University with Dr. Gwendolyn McMillan and her group. And right here in Detroit at Galilee Missionary Baptist Church, I'm working with, matter of fact, this Saturday, every other Saturday, We have the children come in, learn how to read. And of course, I sneak my toe can't go on them and they can start. And I got them bringing healthy snacks instead of all that crap they were bringing. So now they have fresh fruit, and the kids don't have those stale, funny looking plastic donuts. Now they have fresh fruit and they have good snacks to eat. So that's always a plus.
Awesome. So we're going to move toward our closure. We have thank you again. Excellent presentation. Great presentation. Thank you. Thank you so much. Great presentation. Looking forward to getting the book. Informative presentation. Thanks for information. I sure will watch the videos and get the book. Thank you so much, everyone, for coming. We want to again promote the book, My Toe Can't Go. You can get it from store.bookbaby.com. So you can get the book, or you can also get it on Amazon. Make sure that you get the book, okay? I want to close by saying thank you to Dr. Simone, who had to leave. Of course, she's somewhere over the Atlantic now, heading to Barbados.
Right.
So thank you so much, Dr. Simone. We'll get her back again. I loved her. She said in her presentation, feet don't grow back. And that was very impactful to me because sometimes we're very callous, or sometimes we think about amputation as a secondary thought. But when we think of it that it is tantamount to the person losing their life, then it will help us to be more alert. And then we must think feet don't grow back. Toenail grow back, but toe don't grow back. And so we need to definitely be vigilant about helping persons to protect their feet and to save their feet for life. We want to just thank everyone for coming. And then our next meeting is actually November 10th, I believe, the second Thursday in November. Can you believe we only have 2 more meetings for the year? And we have actually done every month this year. So we're very grateful for your attendance and your participation. We want to say thank you again for coming. If you have any questions or you have any comments, you need to get in touch with me. You can do it by, November 14th is, yes, that's World Diabetes Day. I'm sorry. World Diabetes Day. We will be having an exciting program on that day because it's actually the actual World Diabetes Day. So we will definitely be having an exciting program that day. And then December will be our last one for the year. So come and join us on November 14th right here. We'll be on our Zoom. We'll probably be live streaming a couple of places because we'll be partnering with the Diabetic Association as well as the Diabetes Educators Association. Dr. Horsley will be here. I will be here. We definitely want you to come and join us. We will have an exciting program. Maybe we'll showcase the book again because we really definitely want persons to get this book in their hands. Thank you so much. I don't see Pastor Dorset anymore. So we're going to ask Elder Mitchell to just give us our closing prayer. And then we are going to end. Enlightening presentation. Thank you. Thank you. Oh my goodness. We have someone from Mexico as well. So everywhere. Thank you so much.
Let us pray. Father, thank you for this wonderful program. Thank you for the information that you have shared with us through the various speakers about how to take care of ourselves, how to improve our qualities of life, and how to extend our lives. We ask you that you would give us guidance and wisdom that we may put these things into action and that we may share them with those of our loved ones and those with whom we come in contact, so they too may be better informed for a better quality of life. As we now depart this meeting, may we never be from under the umbrella of your protection. And may we have a good evening in Jesus' name. Amen.
Amen. Amen. Thank you so much, everyone, for coming. We had a wonderful evening. So thank you so much again. Bye. Bye. Enjoy. Good
Bye.
night.
Enjoy
Good night. Good night,
everything.
everybody. Good night.
Good night,
Okay, good night.
everybody.
Good night.
I'm putting
Good
my
night.
number in the chat in case you
Good
need to get in touch with me. You can do
Yes,
that.
yes, we'll get in touch with you. Excellent.
Have a good night, everybody from
Good
Mexico.
night.
Yay, all right to
you
Mexico. All right. Hola. Yes, indeed. Yes,
Thank you
indeed.
so much. Good
You're
night.
welcome.
Good night. Well, Dr. Mitchell, I'm gonna say good night and I always eat late. 'Cause
Yes.
I've been working out with this new knee, so I feel
I-
brand new on my right side.
Show off. Go ahead.
Get that left knee popped in and I'll be able to get out of the ocean. Because
Wow.
it's easy to get in, but I was having trouble getting out with the low embankment. So
I know.
now now I get both knees repaired and I can just fly out the ocean, fly in and fly out. And I need some of that salt water on my knee.
Yes.
So thanks again. And I'm going to go ahead and get something to eat. And I will see you on International World Podiatry Day. That's what's coming up. Okay.
Yeah.
All right.
Yes.
Take care. All right.
Okay, good night, Dr. Mitchell. Good night again.
Night, everyone.
Yes,
Good
excellent,
night.
excellent,
Thank you all so
excellent.
much for coming.
Excellent
Wonderful.
work, excellent work.
Thank you.
Okay. We would want to have the books, right? You let us know how we can get them.
Yes, I will send some information.
Yes.
Good night. Good night. Thank you for the information.
You're good night. Thank you too.
Good night, Dr. Mitchell.
Good night. Good night. I'm glad to hear that they do have podiatry clinics in St. Lucia and Barbados. So that's good. We want to definitely have move towards the comprehensive foot clinic. That would be fantastic. So move that.
Good night, Dr. Mitchell.
Good night. Hey, how you doing? Good night.
I am great. I am great. I couldn't get this thing unmute to Dr. Horsley.
I'll let him know.
I enjoyed the presentation.
Awesome. But you definitely have to get the book.
Yes, yes, yes. And I'm hoping to be in Nassau on the 14th of November, so I hope I could be too.
Oh, well, awesome. We're actually having a day seminar on the 14th as well. And then we're going to do something on Zoom for those persons who can't come. So, but we'll have a daytime seminar. Yes, on the 14th. And then in the evening, we'll have like a recap for those persons who are online.
Okay. All right. Well, I hoping to be in Nassau, so I'll see if I can catch up with the seminar.
Okay. All right. Text me and let me know.
When does it start?
It's going to be in the day. So probably like 9, 10 in the morning. And then go till mid-afternoon, and then we'll do the Zoom later in the evening, like now.
Okay. All right.
Okay.
All right.
All right.
Good night.
No problem. Good night. Another 2 minutes. Someone is asking where in St. Lucia can we get a podiatrist clinic? So if someone in St. Lucia is still online, can you answer that question, please? You can unmute and answer. Let me look. Dominica, St. Lucia, Ann Barley. She's gone, I think. St. Lucia, Deborah from St. Lucia. Mary Desir. Looks like all our St. Lucia people gone. Claudine. Just give me your email. Okay, Deborah's answering. She said she both in the north and in the south. Okay. All right, so there's Deborah's given an email here in the chat. So if you want, you can just take that email and you can get in touch with her and then get connected. Awesome. The name of the book is My Toe Can't Go. And it's Dr. Horsley, and I can't remember the other person's name, but it's a young lady here who is from the Bahamas who wrote the book with him. My Toe Can't Go. And you can get it from Amazon, or you can get it from store.bookbaby.com. Any one of them is fine. You can get it from. I just love the characters and all the persons. All of them have food names, if you notice that. So that was good too. Okay, I'm gonna stop the chat now. So good night, everyone. Good night.